And that brings us to a big part of the Medicare debate. Should the eligibility age for future retirees be raised from 65 to 67? Many Democrats have pressured the president this week to oppose any attempt to do so. But in an interview with ABC News, President Obama indicated he may be open to the idea as part of a compromise. We have our own debate about this and its potential impact. Neera Tanden is president of the Center for American Progress. She previously worked for the Obama administration, working on health care reform. And Tevi Troy is a senior fellow at the Hudson Institute and a former deputy secretary of Health and Human Services in the George W. Bush administration. He served as Mitt Romney's health care policy advisor during the just completed presidential campaign. And Tevi Troy, if we phase in a higher age for Medicaid eligibility, do you really save much money?
Well, yeah, over a 10-year period, we're looking at about $125 billion in savings. Over a 75-year period, we're looking about $1 trillion off Medicare's long-term liabilities. So this is real money. It makes a real difference over 20 years, 5% savings. And look, the Kohut argument is that people want cuts, but they don't want to specify the cuts. Policymakers have to make choices about what the best cuts are.
Are there any countervailing costs we have to worry about? If you move the bar from 65 to 67, don't people arrive at the threshold after years of or underinsurance, sicker and thus more expensive than they would have been had they entered the program earlier?
Well, there are certainly problems, and it's not perfect. And Neera's study talks a little bit about this. But what you have is, first of all, it's phased in over a long period of time. Second of all, people are living a lot longer. When Social Security first came around, people were living till 62. Medicare, they were living till 70. Now people are living till 80 years old. People retiring now are spending 30% of their time in retirement. So we really need some kind of alternative because we can't afford to pay for these beneficiaries for such a long period.
Neera Tanden, it's widely agreed cuts have to come from somewhere. The government, writ large, has to spend less money. Why not save money this way?
Well, we agree, and at the Center for American Progress, we've put forward savings in the Medicare program at $385 billion. We believe there needs to be savings, but we can have savings that actually don't affect beneficiaries this way. And what I would disagree with Tevi about is really this is a way that just simply shifts costs from the federal government to employers, states, and seniors themselves. And in fact, because Medicare is a program that is extremely efficient, it's actually cheaper per beneficiary than private insurance, what ends up happening is that really for the amount of money you save at the federal level, people at the state level, employers, they spend more money per beneficiary. So what will happen is we'll have 400,000 seniors, we estimate 400,000 seniors without health insurance. And for those who do have health insurance, their cost will rise as an average of $2,000. So this is really a very poor idea of how to save money, because what it's doing is increasing what we spend as a country on health care, just to simply lower the federal budget. That makes no sense. And
didn't we do something similar with Social Security? By changing the eligibility date, people had to, over time, change their plans. They worked longer. They realized they were going to retire at 67, not at 65. Would people make similar adjustments in the face of a new Medicare eligibility age?
I'm so glad you asked about Social Security, because this has been a very poor analogy that people have used on both sides. Because, you know, we don't believe, no one believes, Democrats don't believe, Republicans don't believe in universal retirement. We all recognize retirement is for a certain age. But as Democrats and progressives, and the president himself has believed in universal health care. We have the Affordable Care Act because we believe people should have insurance. We have systems of private insurance because we think people should have insurance. We don't think that people should just not have insurance below a certain age. So really what we're saying, and because of the Affordable Care Act, we have a system where a lot of these seniors who are cut off Medicare will move to private insurance or the Affordable Care Act, but it will just cost more money when we do so. And for us, that makes no sense. And for conservatives who've argued about competitiveness and the need to get our economy going, the idea that we're going to take seniors 65, 66, 67 years old out of the Medicare pool, where they're the cheapest group in that pool, and they bring the cost of that pool down, and put them in the pool of employers, you're going to raise the cost of insurance for everybody in the private insurance system and for employers, make it more expensive to provide insurance. So this is really a bad idea for for companies, for states who have big costs, and that's why we think it's a poor idea.
Tevi Troy, what about Neera Tanden's point?
Well, sure, there's cost shifting. The whole point of this is that you're reducing Medicare's costs, and somebody has to pay. That's why those polls earlier show that people don't want to do this. But the fact is that you'll be reducing Medicare costs by $125 billion. If you're making this argument that that the Affordable Care Act gives people opportunities to get insurance elsewhere, then that's what we're doing here. And in addition, this is effectively a form of means testing. It's saying that the wealthiest seniors will have to pay more. They'll have to either get insurance privately or work longer, and that the poorest seniors will be more likely to go on Medicaid, may work longer, or they may also go on the exchanges. So there are other options out there, but this is it. This is the point, is we're trying to force people to make choices.
As we're phasing in the Affordable Care Act as a nation, many states are, as they were allowed by the Supreme Court decision, opting out of that new Medicaid plan. Can Medicaid really pick up the slack if the poorest seniors are going to get less services in the states where they're living?
Well, sure. First of all, we don't know how many states are going to take up the Medicaid expansion, and we don't know how many states are going to take up the exchanges. I suspect that more states will do the Medicaid expansion than will do the exchanges, and that's what we're seeing so far. But the fact is that there will be a number of options. Medicaid is one of them. The exchanges is one of them. Working longer is one of them. And again, for the wealthier seniors, they're the ones who are going to have to bear the biggest brunt of this. The poorer seniors have more options.
Neera Tanden, you just heard, Tevi Troy submits that there are places in the design of current health care policy to pick up some of the slack for those 65 to 67-year-olds.
Sure.
Why wouldn't it work?
Sure. Many will be picked up in the slack, but many won't be. And, we put out a report this week that shows that we'll have 400,000 seniors that won't have health insurance. A lot of those seniors will come from states where they're not doing the Medicaid expansion, so they'll be lost in the cracks, if you will. And those are people who would be working poor today. And so, we're talking about making those seniors the most vulnerable. And when Tevi discusses the $125 billion this would save, we recognize that there's a need for savings, but we can have savings in the Medicare program that doesn't hit beneficiaries, that doesn't break the promise of Medicare, the promise that's been made to seniors, and that really looks at things like competitive bidding, other ways that you can derive savings in the healthcare system by making it more effective and more efficient, and to drive down national health expenditures, because that should be all our goal. Instead of simply making seniors pay more for their health care, we should actually reduce those expenditures.
Neera Tanden and Tevi Troy, thank you both.
Thank you.
Our reporting partners at Kaiser Health News asked policy experts how they would control Medicare costs. Read their responses online, and you can see the full Pew Research Center poll as well.